If you are planning on getting pregnant, please don't leave it to luck. Know how to get pregnant faster this year, 2024, by first of all predicting your ovulation and knowing the do's and don'ts on how to maximize your fertility. My name is Dr. Nkiruka Bridget at OBGYN Talks with Dr-Adazion. I'm a consultant obstetrician gynecologist. I discuss everything about women's health, children's health, and sometimes men's health. Follow me on Facebook, TikTok, and on Instagram with the same name, OBGYN Talks with Dr-Adazion. Hit the notification button, the subscription button if you are yet to subscribe. So today, we'll be discussing how to get pregnant faster this year, 2024. Welcome to my page. So if this interests you, let's go on. Some couple get pregnant merely by talking about it, while others, it may take time. If you're looking for tips on how to get pregnant faster, here are things you need to know. Number one is predicting your ovulation. Predicting ovulation and having sex frequently, up to 5 times a week, may help you improve the chances of you getting pregnant this 2024. What is ovulation? Ovulation is just the process of the woman's body, the ovaries, releasing an egg. And this egg migrates through the end of the fallopian tubes. When it's picked by the fimbriae, that's the end of the fallopian tubes, it migrates through the fallopian tubes and stays at the middle of the fallopian tubes, where we call the ampulla. It stays there and waits for any sperm, living sperm, to come and fertilize it. So for someone that has 28 days cycle length, if you watch from our previous video, which we've discussed before, ovulation is usually at the 14th day before the next menses. So if you have a cycle length that is 28 days, it's already assumed the ovulation is on 14th day of your cycle. And if you want to get pregnant, you are expected to have frequent intercourse immediately after your period, before your ovulation, and on the day of ovulation. Those that have frequent intercourse every day, or at least every other day, stand the better chances of getting pregnant. However, if you don't seem to enjoy frequent intercourse daily, you can have up to 2 to 3 intercourse interspersed between the weeks. It will help you to get pregnant faster. If you know your ovulation date and know when your cycle length and know when you ovulate, it will also help you to get pregnant faster, because you are expected to have intercourse before your ovulation date and on the ovulation day. So the egg released is expected to migrate and live in the fallopian tube 12 to 24 hours before it dies off. Sperm cell can live up to 5 days in the body, that is in the uterus, in the womb, so far that the condition is right. So when you ovulate and you have studied your body very well and you have frequent intercourse and there is presence of a living active sperm in the fallopian tube, fertilization will occur, because it will be in the fallopian tube and the egg will be there and it will fertilize. However, we prefer a sperm waiting already before the egg is released. It helps it to fertilize early enough and for you to get pregnant. And if you seem not to have the normal 28-day cycle length, which will give you that your ovulation date is on the 14th day, it's expected that you keep a menstrual calendar. That menstrual calendar will help you to choose the day you ovulate. If you keep a menstrual calendar, remember what I said before, ovulation occurs 14th day before the next menses, not 14th day after the menses, 14th day before the next menses. So when you calculate retrospectively, you'll be able to know when you ovulate. So keeping a menstrual calendar will help you to know exactly when you ovulated. Other signs that will help you to know when you ovulate, especially if your cycle length is not 28 days, is to know some changes in your body, which include changes in your cervical mucus. Most women have different cervical mucus seen in different part of their cycle length. For example, after your menses, the person will start having some vaginal discharge, that is the cervical mucus, that may just be watery and not too clear, but close to ovulation, you will see that the vaginal discharge is clear, stretchy, and mucoid. Now, it is hormone dependent. After your ovulation, that same cervical discharge, cervical mucus, will now become thick and not clear anymore. So This will help you. If you're someone that is very keen about your body changes, and you are very keen about the cervical changes that you see, cervical mucus changes, you will notice this. Close to ovulation, you will see a very stretchy, mucoid, clear cervical mucus that even your hand, you can use your hand to stretch it. But after ovulation, it disappears, becomes thick, you cannot stretch anymore, and it becomes not clear. So it is hormone dependent. Now, the next thing is your body temperature. Some people that are keen about their basal body temperature can detect an increase in body temperature just before ovulation or on the ovulation date. So before that increase in ovulation date in body temperature is measured, you are most fertile at that time. So for people that want to use basal body temperature, get a thermometer that records basal body temperature and take these recordings immediately you wake up from sleep. Record them and see the pattern. Before your ovulation, you will now see that the temperature will increase. Some days before the increase in temperature, that's when you are most fertile. So you can have intercourse at that moment. Now, others may have pain that shows some ovulation. This is different for some individual depending on your pain threshold. Someone that has a very low pain threshold will recognize this, that at the point of ovulation, you may have left or right-sided abdominal pain. These pains correspond with the time of the egg rupturing. So if you are someone that is very keen and notice this, know that you are ovulated. And usually mid-cycle, for those that have 28-day cycle length, so you know that you are ovulated. Some will have pressure in their bum, their buttocks, and they'll find it some discomfort. They'll find some discomfort sitting down. These are signs that the person might have ovulated. So having sex around that time may increase your chances of getting pregnant. If you want to go further, you can get over-the-counter kit for ovulation testing. This kit, when they dictate a hormone, when they show positive, that is luteinizing hormone surge, you ovulate around 36 hours after that positive result is noticed. So you can get a over-the-counter ovulation kit, and you can test with your urine. It will detect that hormone if you are about to ovulate, and just know that within 1 to 2 days after that first positive result, you have ovulated. How do you maximize your fertility? What do you do to increase your chances of getting pregnant this 2024? That pregnancy that you desire must happen this 2024. So these are the things to do to maximize your chances of fertility this 2024. If you're yet to subscribe to my page, please do so now at OBGYN Talks with Dr. Adazion. Share this video at this moment. Let's go on. So how do you maximize your fertility? Number 1, have sex regularly. Couples that have sex regularly have a higher chances of conceiving. It's expected that you have sex daily, starting from immediately after your menses and continuing to past your ovulation. Those that have sex regularly, daily, have better chance of conceiving. If you do not have sex regularly, or you do not enjoy sex every day, you can have sex every other day. Number 2 is have sex as close to your ovulation or on the ovulation date as much as possible. It has also been noted that if having a live active sperm in the fallopian tubes before your ovulation, it helps improve fertilization. What do I mean? If you had sex every other day, it will give you that chance of having a live active spermatozoa in the fallopian tube. Remember I said that it can stay up to 5 days in the fallopian tube depending the condition of that body. So if the condition is right, the spermatozoa can stay for up to 5 days. So when you have sex every other day before your ovulation and on the ovulation date, it helps improve your chances of getting pregnant. If you cannot have sex every other day, at least have sexual intercourse between 2 to 3 days in a week, interspersed within the week. The aim is to have an active live spermatozoa in the fallopian tube waiting to fertilize the ovum, the egg released. The second thing is to maintain a normal weight. Overweight, obesity, or underweight has an adverse effect on fertility. Maintaining a healthy weight is very good for you to get pregnant this 2024. Don't be overweight, don't be underweight. Now, the third thing is eat healthy. A balanced diet will also help your immune system and help your eggs to grow well. Balanced diet, fruits, vegetables, minerals, vitamins, protein, carbohydrates in a balanced proportion will help you get pregnant. Now, if need be, please talk to your doctor. Talk to your doctor, because your doctor will check your overall health and see if there is anything that he needs to do about your health. Your doctor may even start you on preconceptional care and may ask you to start taking folic acid some months even before you conceive. This is to help prevent some abnormalities on the fetus or on the embryo that will be formed, to prevent things like neural tube defect and spinal bifida. So talking to your doctor is very necessary if you need to, for you to get pregnant this year. If there are other things that are wrong, your doctor will find out and advise you or treat you on what to do and what not to do. So what are the things you should not do if you are planning to get pregnant this 2024? If you need to talk to a doctor, you can hit my DM right now or hit the number only WhatsApp. You can WhatsApp me this moment. So what are the things you are not supposed to do? Don't smoke. If you're already smoking before you try getting pregnant, meet your doctor to help you stop smoking. Smoking has adverse effects on the quality of eggs produced. Not to talk of your general health. It has adverse effects on the quality of egg that will be produced. It has adverse effects on the fetus that will be conceived. So smoking is not good for your fertility this year. Don't drink. Excessive alcohol has adverse effects on pregnancy. And so as much as possible, if you are planning to conceive, to get pregnant this year, quit alcohol as much as possible. Some researchers have said that caffeine may not have effect on your fertility when you take less than 200 milligrams per day. However, when you start taking above that level per day, I don't know what will happen. It may affect your health. Don't do overstrenuous exercise. Overstrenuous exercise may affect your body, in quotes, because your body will see that it's being stressed and will not be able to release egg as when due. If you need to talk to a doctor and you have tried to get pregnant for the last 1 year and it's not working, you really do need to see your doctor, because infertility is after 1 year of unprotected, regular, adequate sexual intercourse. So if you have been having unprotected, regular, adequate, enjoyable sexual intercourse for the past 1 year and fertility is not happening, it's time for you to see your doctor. Now, if you are 35 years and above and you have tried to get pregnant for the past 6 months and it has not happened, please see a gynecologist to sort out and rule out what is not proper. If your partner has some issues about fertility, see your doctor with him so that this can be sorted out for you to get pregnant this year. I wish you the best of luck. I'm waiting to hear your testimony. Thank you for watching to this point. I remain Dr. Nkiruka Bridget at OBGYN Talks with Dr. Adazion. Share this video at this moment. Subscribe to my page. Thank you. See you next week for another enriching video. Thanks.